Today, we have a patient undergoing two advanced hair restoration procedures: Follicular Unit Transplantation, FUT, and Follicular Unit Extraction, FUE. During the FUT procedure, a strip of the scalp is removed, and individual follicular units are dissected from this strip for transplantation. In contrast, the FUE procedure involves extracting individual follicular units directly from the scalp. These techniques will be used to achieve a fuller, more natural-looking hairline for the patient. Here's a step-by-step breakdown of the procedure. Consultation. The journey begins with a thorough consultation with a hair transplant surgeon. During this session, the surgeon evaluates the patient's hair loss pattern, examines the donor area, discusses expectations, and assesses the patient's suitability for FUT or FUE. FUT procedure. Preparation. On the day of the procedure, the surgical team prepares the patient by cleansing the scalp, extracting a blood sample for plasma enrichment to facilitate healing, and administering local anesthesia to numb the donor and recipient areas. Donor strip removal. A strip of hair-bearing scalp tissue is surgically excised from the donor area. The surgeon uses a scalpel to carefully remove the strip, ensuring minimal trauma to surrounding tissues and preservation of hair follicles. Closure of donor area. The donor area is then closed using sutures or staples, depending on factors such as scalp elasticity and the surgeon's preference. Dissection of donor strip. The extracted strip is dissected under a microscope into individual follicular units. These units typically contain 1 to 4 hairs each and are meticulously separated to maintain their integrity. Graft preservation. The harvested grafts undergo cleaning, sorting, and preservation to optimize their viability and enhance results.
Before we continue, please visit hairtransplant.com for more information.
FUE procedure. After the FUT procedure, the doctor uses ultrasound technology to examine the angles of the follicles. Preparation. Like the FUT procedure, the FUE procedure involves meticulous preparation. The surgical team prepares the patient by cleansing the scalp and administering local anesthesia to numb the donor and recipient areas. Extraction. Using a specialized micro-punch tool, the surgeon carefully extracts individual hair follicles from the donor area. This process leaves tiny, round scars that are usually not noticeable once the hair grows back. Graft preparation. The extracted follicles are examined under a microscope and prepared for transplantation. Only the healthiest follicles are selected for grafting. After undergoing FUT and FUE procedures, the next crucial step is preparing the recipient area, where the hair will be transplanted. The recipient sites in the scalp are meticulously created by the surgeon. This process involves strategic planning to ensure the placement of these sites achieves a natural-looking hairline and overall density. Graft placement. Finally, the surgeon and their team carefully insert the dissected follicular units from the FUT procedure and the extracted follicles from the FUE procedure into the recipient sites. The angle, depth, and direction of placement are critical for achieving aesthetically pleasing results. And there you have it. That's the complete process for Follicular Unit Transplantation, FUT, and Follicular Unit Extraction, FUE procedures. Our patient is now on their way to achieving a fuller, more natural-looking head of hair.